Good evening everyone, it's 3rd of December 2025, Wednesday 9:39 p.m. In this video I'll be talking about the cardinal points of the human eye. For that, to explain the cardinal points for human eye, first I'll be talking about the cardinal points for a thin lens system with one example, and for thick lens system with 3 different examples. So what are the cardinal points? Cardinal points, these are optical center, principal center, focal point and nodal point. So these are the cardinal points of any lens system. So usually optical center and the principal center, these are taken as same points for a thin lens system. That I'll be talking about how these are different with these examples. First example, if it is a thin lens system, thin lens which has the symmetrical surface that is taken from a perfect sphere, ideal sphere. If it is taken from an ideal sphere with similar refractive power along its all points, that is called as a symmetrical lens. If it is taken from an ideal sphere, its geometrical center and the optical center will coincide with each other, and the line passing through the center of curvature of the sphere from which it is taken, the line passing through this center of curvature through this optical center, that is geometrical center of this lens, is called as optical axis. So that is about the thin lens system, and it is separated by air medium on either of its sides. So that was about the perfectly symmetrical spherical refractive surface with same medium on either of its sides. It will have optical center that will coincide with the geometrical center of it, that is also called as principal center, and the optical center and principal center will be the same for this thin lens, and it will have the center of center of curvature of the sphere from which it is taken. So it will have, what are the cardinal points for this kind of thin lens system? It will have the optical center equals to principal center. There is no there is no nodal point. We don't have to consider nodal point here. So optical center will coincide with the principal center. It will have the focal point on the image side, focal point on the object side. Then it will have the optical center. That is about the thin lens system. Now I'll be giving 3 examples for thick lens system. In first example, it is the lens. It is a thick lens. It has 2 refractive surfaces, anterior and posterior, which are symmetrical, separated by same medium, suppose air medium on either of its sides, because we live in air and not in water. So I'm going to take an example of air medium that is the same on either of its sides. Then this lens, thick lens, has anterior surface, posterior surface. It has a certain thickness, and these 2 surfaces having the same refractive power. So in this case, it will have the focal point for each of these surfaces, focal point 1 f1 for anterior surface, focal point 2 f2 for the posterior surface. Focal point is the point where the rays they converge, or from where the rays appear to diverge. So that is the focal point. For the concave lens, it is divergent, the rays diverge from the focal point, and for convex lens, the lens converge at the focal point. So that was about the thick lens with the symmetrical surfaces with the same refractive power, same medium on either of its sides. In this case, the principal point, principal point and the nodal points, these will coincide with each other. So this lens system will have the focal point f1. For anterior surface, it will have the focal point f1, and the principal point that is equal to the nodal point. The location will be the same, and it will have the focal point f2 for the posterior surface, and principal point p2 for the posterior surface, and it will coincide with the N2, that is the nodal point. And so we don't have to consider the nodal points for this kind of lens system because they coincide with the principal point. So we say that this kind of lens system which has the anterior posterior surfaces which are symmetrical thick lens system and with same refractive power separated by the same medium on either of its sides, so suppose air or water, whatever. So it will have focal points on either of its sides, and it will have the principal points. You don't need to define the nodal point because principal point will act as a nodal point in this case. They will coincide with each other. Now another example in which the refractive surfaces are symmetrical and the powers are same but media on either of its sides are different. This is a thick lens system. In this case, the nodal points and the principal points, they will not coincide with each other. And another example, fourth example and the third example for the thick lens system. In this case, this is a thick lens and it has anterior surface and the posterior surface. These are not symmetrical and their powers are different. Even the media on either of the sides of this thick lens system, these media are different. Suppose here there is a water, here there is air, and this is the glass. It has its own refractive index. So in this case also the principal point will not coincide with the nodal point. So with diagrams I'll explain these four lens systems and their cardinal points. So this is the first example. This is thin lens. Its surface is symmetrical at each point. It has same refractive power, that is, it is perfectly symmetrical lens surface, and it is taken from an ideal sphere which has this center, and the line passing through this center and geometrical center or center of arc of this lens surface is called as optical axis. So optical axis will be passing through points A and C. Now in this case, the optical center and the principal center, they will coincide with each other and they will coincide with the geometrical center of this lens. So that is the thin lens system. Now what is the optical center? Optical center will coincide with the geometrical center in this case, but optical center is not the geometrical center for each and every kind of lens, only when it is symmetrical and taken from an ideal sphere. This is an example of a thick lens system, both having anterior and posterior surfaces which are symmetrical with same refractive power. Refractive medium on either of its sides is same, air medium. So in this case, the principal point will coincide with the nodal point. Nodal points, both the principal points will coincide with the nodal points for the anterior and posterior surfaces. So this kind of lens system will have the focal point F1, then P1, then F2 and P2 for anterior and posterior surfaces respectively. We don't need to define N1 for this lens system because anyways both are same. Both will coincide at the same location. This is an example of a thick lens system in which anterior and posterior surfaces are not symmetrical. They don't have the similar refractive power. There is air medium on either of its sides. This lens system is a thick lens system, and in these principal points will not coincide with the nodal points of these anterior and posterior surfaces. So anterior surface, it will have the focal point, then principal point and the nodal point F1, P1 and N1 for the object side, and for the image side it will have the F2, P2 and N2, or F dash, P dash and N dash. Now this is an example of a thick lens system. It has anterior surface, posterior surface, it has certain thickness. Anterior surface and posterior surface both are symmetrical, have similar refractive power, and there is air medium on one side, there is water medium suppose on the other side, with refractive index mu1 and mu3 respectively. Now this lens is made up of a glass or a plastic suppose, and it is having the refractive index mu2. Now in this case, again the principal point, it will not coincide with the nodal point. Suppose in this example both the surfaces are not symmetrical and have different refractive power and different media on either of its sides, then in this case also it will have principal points and nodal points different at different locations. So according to Gaussian thick lens system, which has different media on either of its sides, or different refractive surfaces which are asymmetrical, anterior and posterior asymmetrical with different refractive power, or both of these conditions. For a thick lens system, it will have 3 pairs of the cardinal points or 6 cardinal points, fovea, principal point and nodal point for object side and for image side respectively. So these are the 6 cardinal points for a thick lens system, for such thick lens system. Otherwise, the thick lens system that has, you know, similar refractive surfaces anterior and posterior with and same media on either of its sides, it will have principal point that will coincide with the nodal point. So for the human eye, it's very complex situation. We have cornea acting as the lens, then lens acting as the lens. So cornea again has anterior surface and posterior surface. So lens is so thick, it has cortex and the nucleus. Now the cortex has anterior surface, posterior surface, and the nucleus, it can be taken as having 2 surfaces, again anterior and posterior. So each of the lenses, like the cornea can be taken as a thick lens system, it will have 6 cardinal points. Then again lens nucleus can be taken as a thick lens system, it will have 6 cardinal points. And the cortex of the lens can be taken as a thick lens system with its 6 cardinal points. So it's a human eye, it's a very complex system, optical system. And if we, you know, so there are schematic eyes, you know, defining these optical properties and these cardinal points. And this is a really schematic eye, you know, taking it as a thick lens system, averaging the powers of cornea and the lens, taking cornea and the lens as a single lens system with some mathematical calculations to get, you know, near accurate values. So accordingly it can be taken as having 6 cardinal points, which are, you know, focal point and principal point, nodal point on the object side, and again the focal point, principal point and nodal point on the image side, that is on the retinal side, and object side is the visual field. So this is how the human system can be taken as having the cardinal points of the eye. So you should know what is the principal point, what is nodal point, and what is the focal point for the human eye or any lens system, and what is the difference between the principal point, nodal point, and what's the difference between principal point and the optical center, because optical center it coincides with the principal point. If it is like a symmetrical surface, it is optical center, it will coincide with the principal point if it is a thin lens system. So for thick lens system, it will have either 2 principal points and 2 nodal points, or 2 principal points and nodal points coinciding with each other. And the examples I have already explained, I don't need to explain it again and again. So it's time to explain what is the focal point. I have already explained what is the focal point for convex lens and concave lens. It is the point of emergence of the light waves or point of convergence of the light waves. It is a focal point. Now what is the principal point and what is the nodal point? I'll be explaining these 2 points with the diagrams. In this diagram, I'll show how to locate the principal point for this thick lens system. It can be taken as having 2 lens system. Anterior surface can be taken as 1 lens, posterior surface can be taken as another lens. So to locate the principal point P1 for this F1 focal point here, we know that all the cardinal points, they lie on a optical axis. The principal point, nodal point, and the focal points, they will lie, all the 6 cardinal points will lie on the optical axis. Now draw a line that is parallel to the optical axis and passing through this F1. So first it will go refraction through this lens L1 and then through L2 like this, and it will get focused at this point F1. Now extend this ray of light that is parallel to the optical axis like this, and extend this line passing through F1 straight like this, undeviated line from the object side parallel to the optical axis, and the undeviated line passing through the fovea on the object side, and the point of intersection, we are getting the point of intersection here, and draw a line that is perpendicular to the optical axis from this point. The point of intersection of this line with the optical axis will give the principal point. Now this is the plane, this is called as a principal plane, that is passing through the principal point P1. We got this P1 for this focal point that is lying here, suppose on the object side here. So this is how we decide principal point for the optical system or the lens system, thick lens system, this way. And this plane can be taken as a plane where the average refraction, the location, average location where the exact refraction is happening for these two lenses. Suppose this happens here, then here, it happens here, the refraction happens here. So average location, if we take where exactly the refraction is happening, so this is the principal plane where the refraction, all the rays are getting refracted here. This is the summation of all these locations, average location. So this is the plane where the refraction seems to happen, average location, that is the principal plane. Now how to locate the second principal point? It's the same procedure. This is optical axis passing through focal points and the principal points, even the nodal points which are not shown here. Then draw a ray of light parallel to the optical axis, whether from this point or this point, and it will undergo refraction here, it's going refraction here through this lens. And then this is the lens surface, anterior and posterior, taken as different lenses because it has this is a thick lens system that can be divided into two lens systems for convenience. And then it will undergo refraction here, then here, then here, then here, and it will get focused at this point F2. Now to decide for the second principal point location, we need the point of intersection of the light ray that is parallel to the optical axis coming from this object side. Suppose this is object side and this is the image side, and this is F1. So draw a ray of the light that is parallel to the optical axis and continue it as if it is undeviated to these lenses, and then draw a straight line, undeviated line, passing through the focal point F2 like this, that remains undeviated through this lens, and the point of intersection of these two, take it as a reference point to draw a line perpendicular to the optical axis. So this line is the principal plane that is perpendicular to the optical axis, and the point of intersection of this optical axis with the principal plane is called as the principal point. So this is how we locate the principal point mathematically using diagrams for a thick lens system. Suppose the rays are coming from this air medium passing through this lens. This anterior surface of the lens, this is a thick lens system, is divided for a convenience divided into two lenses. This is anterior surface of the lens, posterior surface of the lens, and this is its thickness. Suppose the ray of the light is passing from air medium, then going into this water medium. So the refraction is happening here, everywhere. But when the light is passing from the air medium to the water medium, where exactly the average location or average plane where exactly the refraction is happening, that is the principal plane here. It's happening everywhere because it's the entire thick lens system, but this is taken as the average location. And if the rays of the light are passing from this water medium going to air medium, these are getting refracted everywhere, but exactly where exactly the average location or the average plane where the refraction is happening, that plane is called as principal plane. And the point of intersection of the principal plane for the water to air medium with the optical axis is the P2, and for air to water medium, when the light rays are going from air medium to water medium, the refraction, where exactly the refraction is happening, is the principal plane. And that principal plane, that is perpendicular to the optical axis, that will give the location of the P2. So it seems complex, but you have to understand this. For thorough understanding, it's very important to draw a diagram yourself, and all these lines in between these two planes, two principal planes, all the light rays, they remain undeviated for the mathematical purpose. Any incident ray that is parallel to the optical axis, it will pass through the focal point, either from this medium to this medium or this medium. If it is parallel to the optical axis, it will go through the focal point. So these are the nodal points for a thick lens system, N and N dash. What are these? So this is a thick lens system. This is air medium, suppose on this side, object side. This is the image side. This is suppose vitreous or water medium. This is made up of a glass or any other substance, for example, or any organic material like cornea, lens, anything. So these three having different refractive indices. These are the media, this is the lens, mu1, mu2, mu3 respectively. Then what are these nodal points? So thick lens system has two nodal points for the rays of the light traveling from object side to the image side, or from this side, from this medium to this medium. So it will have nodal point for light rays passing from mu1 to mu3, and this nodal point N dash for the light rays passing from mu3 to this side, mu1. So these nodal points, what is the characteristic of these nodal points? Suppose this light ray is coming from air medium, it is passing through this end point, nodal point, but it will travel like this, and then it will travel like this into the air, into the water medium here. Now this angle is making with the optical axis, suppose r1 or theta 1, and this angle, this emergent ray is making with the optical axis r2 or theta 2. These are going to be same. So in short, there is a linear displacement, but there is no angular displacement. Understood? There is a linear displacement, but there is no angular displacement because theta 1 is equal to theta 2. So it seems that this ray of light is not deviated. It is because there is no angular deviation. There is a linear deviation. Definitely there is a linear deviation, linear displacement, but there is no angular deviation. So any ray of the light passing through the nodal point of the eye seems to remain undeviated because there is no angular displacement. There is linear displacement, but there is no angular deviation. This is the property of the nodal point of the eye, or nodal point of the visual system or optical system or the lens system. So it was all about the cardinal points for the lens system. If it is a lens system that is perfectly symmetrical from an ideal sphere, it will have optical center coinciding with the geometrical center, and it's the principal center, it's also a nodal center. It will have focal point on the image side, it will have the focal point on the object side, and all these lines, all these points, focal points and the principal points, nodal points, optical center, they will lie on the optical axis. They anyways lie on the same axis, that is the optical axis of the same line, optical axis, also known as the principal axis. And in this symmetrical lens with similar medium on either of its sides, its optical center, geometrical center and nodal center, principal center, all are same, all lie at the same location. So that was all about the thin lens system. For a thick lens system, principal points will not coincide with their respective nodal points in three situations. Suppose first situation, or first kind of lens, this is a thick lens. It has anterior and posterior surface which are perfectly symmetrical and having the same refractive power, separated by different media on either of its sides. In that situation, the principal point will not coincide with its respective nodal point. Then another condition, second condition, it is a thick lens. It has same medium on either of the sides of this kind of thick lens, which has anterior surface and posterior surface which are not symmetrical and have different refractive power. In this situation also, P1 will not coincide with N1 and P2 will not be found at the same location as N2. And in third scenario, this is suppose a thick lens which has anterior surface and posterior surface. Anterior surface is not symmetrical with the posterior surface. Their powers, refractive powers, are different, and the medium on this side is suppose air, and this side it is water. That is, the media on either of the sides are different. In this situation also, the P1 will not coincide with N1 and P2 will not coincide with N2. So that was all about these cardinal points for thin lens system and thick lens system. Whatever may be the system, all these cardinal points lie on the same axis, that is the optical axis. It is an imaginary line, a reference line for mathematical calculations, and to define the optical properties of the visual system, to define the locations of the focal points and the nodal points and the principal points and the distance in between them. For that, this is this reference line, optical axis, and then there is a principal plane through which the refraction of the rays, this is the location, exactly the plane where the refraction seems to happen. It is an average point location. It is a plane or the line that joins the locations where the resultant refraction is happening. Means, suppose this is a thick lens, it's happening here. If the light is traveling from this side to this side, this is a thick lens, and the refraction is happening here, 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 at multiple points in this lens. But when it's traveling from this side to this side, like this, then the resultant average or summation of these locations where exactly the refraction is happening, the average refraction is happening at the average of these location points, that plane or the line joining these points considered as a plane, that plane is called as the principal plane, and the point of intersection of this plane with the optical axis, when it's perpendicular to the optical axis, that point is taken as the principal point. And nodal point, it is that point where the angular deviation doesn't happen. When it's a thick lens, there is a linear displacement, but there is no angular deviation, that I have already explained to one of the diagrams that I have already explained. Now the practical applications of these cardinal points. To define the cardinal points of the human eye. Human eye is very complex. It has cornea, then lens, and different refractive media. The air is there in the visual field. Then inside the eye, there is a cornea, there is a lens. Cornea has anterior surface, posterior surface. Lens has anterior surface, posterior surface. Again, cortex of the lens has anterior, posterior surface, and lens nucleus is anterior, posterior surface. And these can be taken as, the cornea itself can be taken as another one thick lens with 6 cardinal points. Lens nucleus with 6 cardinal points. Lens cortex is 6 cardinal points. And if you take the average of these, all the points, and try to oversimplify the human eye and concise all these points into 6 cardinal points, taking the human eye as one thick lens system, visual system, then it will have these 6 points. Focal point on the object side, that is the visual side, object side is the visual side, and then focal point on the image side, that is the retina side, and then the principal point and the nodal points and their respective locations. Now in this situation, the nodal point is very important. It has clinical significance to define the visual angle, and visual angle is very, very important to define the visual acuity. Now what is the visual acuity? The next video will be on the visual acuity, its definition, the factors affecting the visual acuity, and the different charts and the tests for evaluation of one's visual function. That's the visual acuity. So this nodal point, it is very important location where to define the visual angle. Visual angle is nothing but an object, the vertical dimensions of an object making certain angle at the nodal point of the eye. That angle, if it is bigger, then the image size is bigger, and this angle, it depends upon the distance of this object from the nodal point or from the eye itself. So if it is closer, then the angle is bigger and the image size is bigger. If the image size is bigger, we can get the clearer vision, better details if the eye is lacking any pathology and such. If the distance increases, the visual distance of an object increases with the nodal point of the eye, then the same object will subtend less visual angle at the nodal point, and the same object, if it is going away, it is of same size as it's subtending lesser and lesser angle as it's moving further or far away from the human eye. It is perceived as a smaller object as it passes away from the eye. It moves away from the eye. So that is the importance of the nodal point of the eye to define this visual angle. Visual angle is nothing but the vertical dimensions there. The angle subtended by the light rays coming from the edges of vertical edges of an object, making an angle at the nodal point. So that angle is called as a visual angle. So if the object is bigger, it will subtend bigger angle at the nodal point, and if it is smaller, it will subtend smaller angle. And the same object, if it is closer to the eye, it will subtend a more angle and bigger angle, and if it is away from the eye, it will subtend smaller angle. So this angle, it defines the visual acuity, how better if the retinal image of an object is bigger, and that which depends upon the visual acuity, which depends upon the object size and the distance of an object from the eye. All these factors, one can see better if this image that is formed on the retina is bigger. That is again dependent on this visual angle. So that is the importance of the nodal point in defining the visual angle, and again to define the visual acuity of a person, to test the visual function of a person. So that is one of the clinical significances of nodal point of the eye. And another clinical significance of nodal point of eye is if there is retinal hemorrhage of a certain size, and it can be taken from this nodal point that is lying on the optical axis. Okay, so if the retinal hemorrhage size is this much, so how much what size of the scotoma it will project in the visual field. For that also we need the nodal point as a reference point to measure the size of the retinal hemorrhage, and the size of visual scotoma it will project in the visual field object side. For that also it's very important to locate and know about this nodal point of the eye, where the rays of the light are not, there is no angular deviation of the rays of the light, and that's why it's very important for the mathematical calculation of the size of the retinal image, then visual angle, and also visual scotoma if there is, and also retinal scar and retinal hemorrhage size. If we know the retinal hemorrhage size and scar size, we can calculate using the nodal point and linear properties of the rays of the light. We can calculate the size of the visual scotoma that the retinal hemorrhage or retinal scar it projects into the visual field. We can calculate the size of it, and from the scotomata, the size of the scotoma also, we can calculate the size of the retinal scar and retinal hemorrhage. That's the clinical significance of the nodal point. So nodal point is very, very important, and that's why it's very, very important to know these cardinal points of the human eye. And principal point, usually it is for the distance calculation, and this nodal point usually is calculated from the it's 5.5 mm from the corneal pole. Now what is corneal pole? Corneal apex, corneal pole, corneal geometrical center, and corneal vortex. These are different things. It is the corneal pole. It is the location where the optical axis intersects the cornea, and cornea it can be taken as the most forward projection of the cornea, which can be, corneal apex and the corneal pole usually are referred as similar points. Corneal apex is the maximum, where the maximum curvature, the steepest point of the cornea, that is the corneal apex. And geometrical center of the cornea, it's, suppose this is my hand, geometrical center is somewhere here. So geometrical center, we know what is geometrical center. So geometrical center and this corneal vortex and the corneal pole, they don't coincide with each other. And even we see the rays of the light clearer when the rays of the light, they fall onto the fovea, that is, and fovea and the optical axis, that is the optical axis of the human eye, human lens system. It doesn't fall, or it doesn't coincide with the fovea, and that's usually what happens. All the cardinal points of a lens system, what they lie on the focal points, but when the rays of the light are focused on the fovea of the eye, human brain will perceive these points, perceive that object as a clearer object, and not where the fovea of the human focal point of the human eye system lies. It is on the optical axis, where it intersects on the retina. Where it intersects on the retina, optical axis, it intersects where exactly it intersects. So see, visual axis, it lies nasally and superiorly to the optical axis. Where it lies temporally and inferiorly to the point where the optical axis intersects with the retina. Suppose this is the retina, this is fovea, and this is where the optical axis intersects at the retina. So here this is the optical axis. Fovea is inferior and temporal. This is the nasal point, this is the temporal. So fovea is temporal and inferior to the point of intersection of the optical axis with the retina. So how it will project outside? So that's why the visual axis that passes through the nodal point and meets the fovea, it lies nasal and superiorly to the optical axis. It lies around 5 degree nasal and 1 degree superior. Exact point is 3 to 5 degree nasal and 2 to 3 degree superior to the optical axis. It's very, very important, because what happens, focal points, the cardinal points, as we have discussed, they lie on the optical axis. Now here in the human eye, the focal point lies where it lies in the retina and not on the fovea. It lies on the non-foveal point, and that will give rise to, but this point when the rays of the light will focus at this non-foveal point, the image will not be clearer. It won't be perceived as a clearer image by our brain. It will be taken as a clearer image only when it falls on the fovea, that is not a cardinal point for the optical system of the eye. And optical axis, this fovea doesn't lie on the optical axis where the rays of the light are getting focused, and brain is perceiving that image here that's forming at the foveal point as the clearer object. So the reference line for human eye system is the visual axis, and it's very, very important to know the angle between the visual axis and the optical axis, that is the angle alpha, and it is around 5 degree. That is 5 degree horizontally nasal and vertically 2 to 3 degree or 1 degree superior in the visual field. This is in the visual field, that is on the object side. That's why this first Purkinje image, that is the line of sight. Line of sight means it is the line that is passing through the center of the pupil and the object. So that is the line of sight, and usually the visual axis and the line of sight are taken, the angle is so small that can be taken as the line of visual axis and line of sight are taken at same line. So first Purkinje image, it coincides with this visual axis. Usually it coincides with the visual axis because it falls on the fovea. So first Purkinje image, it lies on the vertex. The line of the intersection of the line of sight with the cornea is called as corneal vertex, and first Purkinje image is said to be formed on the line of on this point, but corneal vertex is not the line of intersection of the visual axis with the cornea, and no, it's not that line, but the angle is so small between the line of sight and the visual axis, it can be taken as same. So first Purkinje image can be taken as, you know, forming on the visual axis, point of intersection of the visual axis with the cornea. So it forms the Hirschsprung's reflex and all these things to measure the squint using that Hirschsprung's test. So the patient should not look at distant object. Patient should look at look at the torch to, you know, measure the squint. That's the basis, because we are measuring the visual axis. Visual axis is from the point of fixation to the fovea, and this first Purkinje image, it coincides with almost approximately coincides with this visual axis, point of intersection of the visual axis with the cornea. So this is very important to know to carry out the test, because you should, you know, why the patient should look at the torch and not at the infinity. So this is very important. Distant object, this is very important basis. Once you know the concepts, you know why the patient should fix it at the source of the light and not towards the infinity when we are doing the Hirschsprung's corneal reflex test to measure the squint. So it's very important, and we know that when the image formation is not, you know, when the object is not aligned with the optical axis of a lens system. This is a lens system, it's optical axis, and when the object is not along this optical axis and in the periphery, it gives rise to the coma aberration. Now, what are these aberrations? I'll be talking about the aberrations of the human eye or any lens system when I'll be talking about the visual acuity. But coma aberration occurs when the object is not aligned with the optical axis of it is not aligned with the optical axis of a lens system. If it is in the periphery, then it will give rise to, you know, coma kind of not sharp image formation, but in the shape of coma. The point object will form a coma shape, like it is spread out in the shape of a comma, and we see that comma shaped image in the visual field. So yeah, so that's why it's very important. And the interesting fact is that now this comma, it is related to the visual axis and not exactly with the optical axis. Now we have to take into consideration the optical axis also and visual axis also, and that's why this angle is very important to define this comma aberration also, and maybe different kind of aberrations that I'll encounter later on as I proceed, you know, as I go through different optical books, because I have gone through so many books on optics to read a single chapter, and took me, you know, days and hours to make this video. And it's very difficult to articulate these concepts. These are very difficult concepts to grasp, so you have to think a lot and you have to give a lot of time to think and find out the answers, and again you have to take a lot of time. It's very difficult process to present it verbally and through diagrams to make it comprehensive, or to simplify it to the people so that people can understand it. It's very important to read it on your own, different books. So that's why to define the aberrations also you should know this angulation between the visual axis and the optical axis, because the comma aberration is defined with respect to the optical axis. But here the focal point, the cardinal point, taken as a cardinal point, it lies on the point on this non-foveal point, but the rays of the light, when they are focused at the fovea, when the eye is aligned with the visual axis, then only the brain will perceive it as clearer object. So for comma aberration, we have to take into consideration the optical axis and the visual axis location also, their angle and the object location in the visual field with respect to the visual axis and with respect to the optical axis. It's very important, and these things are not given in the books. These things I'm using, you know, I'm applying my own theoretical knowledge to integrate all this information and how it can be used and how it can be applied to the human eye. It's very important. That's why this angle is very important, because any kind of lens system, microscope or telescope, any or camera, we get the sharpest image formation when the object is aligned with the optical axis and the focal point lies on the optical axis. But in human eye, when the focal point though lies on the optical axis, it corresponds with the non-foveal point, and fovea, it lies temporal and inferior to this focal point of the visual system, human eye system. So what kind of, you know, and the image formation, the rays of the light should be focused on this fovea and not the focal point of the human eye. So it's very important. That's why the visual axis we need to define for the human eye, because this eye needs to be aligned with this, and optical axis and the visual axis will never coincide with each other. So I hope you understand this complex you know, visual system of human eye and its optical properties, image formations. I hope you understood a little bit. If you read on your own, then only you'll understand, because I don't have, you know, animations, and I don't have that much time to edit the videos and add so many videos and photographs in that. I don't have that much time, so I'm just verbally expressing, and you will get only when you will read these things on your own. And I'm not going to you know, tell the names of the authors and names of the books I have read to clear my concepts related to the human eye optics. So this topic is very difficult. I'm not going to tell, because my content and my research topics are copied, and I'm, you know, I'm not given opportunities for, be it video retina surgery or be it any educational opportunities where my growth will happen. Once I get the secure stable position in my career, once I start earning, once I'll be financially stable with secure position as a video retina surgeon, consultant, professor, whatever in future, definitely then only I'm going to, you know, make my resources available to you all, because my contents are stolen, my research topics are stolen, and these people are supported by edits, and then these are promoted by stealing my ideas and research topics, pulling me down. And that's why I'll make my resources available only when I be a financially stable person and be a video retina surgeon, successful, skilled, independent video retina surgeon, consultant, then associate professor, and then professor. Once I you know, secure my career position and be financially stable, only then I'm going to make my resources available to public here. Otherwise my work is stolen, my research topics are stolen, and these stealers and, you know, corrupt people are given opportunities to grow, and, you know, I'm suppressed for 4 years till now. So that's why I'm very much reluctant to, you know, reveal my resources. I'm not going to reveal my resources. And Khurana, not at all enough. Then Elkington, not at all enough to understand optics of the human eye. You have to, you know, you have to read so many standard books. I have the names and the authors of these books, but I'm not going to disclose this publicly till I secure my, you know, stable career position that I want, and till I become financially stable. Thank you so much for listening to me. Bye. Good night.